Welcome to Lunch Hour Live. I'm Sue O'Connell. Oh my gosh, the United States. We're currently facing two pandemics, the coronavirus and systemic racism, while thousands of Americans are protesting the killing of George Floyd at the hands of a police officer and calling for reform of the justice system. All the while, the coronavirus is continuing to wreak havoc. Well, the intersection of these two moments in time is making us consider and ask, what does it mean to be an activist in the age of COVID-19? Well, I brought some folks in to answer this question and also continue the conversation. I'm joined by Dr. Cheryl Clark. She is the Director of Health Equity Research and Intervention at the Brigham and Women's Center for Community Health and Health Equity. Welcome. Thank you for joining us.
Thanks, Sue. Thanks for having me.
And Monica Cannon-Grant, the Executive Director of Violence in Boston and a woman behind last week's protest in Franklin Park. Welcome, Monica. Good to see you again.
Good to see you, Sue.
So, Monica, I've been teasing you that you're sort of like the overnight sensation. You've been working on these issues in the trenches for at least a decade. And you were the organizer, as I mentioned, behind last week's protest in Franklin Park. So I want to ask, because, I had my mama antenna up while I'm watching everybody, hoping that they're going to be wearing masks. And you and I interacted at the beginning of the pandemic before we were all wearing masks. And I'm happy to say, as soon as I saw you, you said, here's a mask, put it on. I'm just wondering what the protest was like for you during the pandemic, and what your concerns were about folks' health regarding the pandemic.
So it definitely was a concern from the very beginning. Before the protests, we had been feeding our community for the last 12 weeks. And so my routine has entailed serving food, going home, getting undressed at the door, jumping in the shower before I could even pick up my 1-year-old. So at this point, it's become a way of life. When we decided to do the protest, one of the things that we tried to do at our rallying point was draw circles on the ground for social distancing. That didn't work because we had thousands and thousands and thousands of people, but we at least made sure that everyone had PPE, that everyone had gloves, hand sanitizer, and we tried to make sure we reiterated the message that, yes, we're out here mobilizing because an injustice has happened, but we also don't want to cause people to die from COVID. And I mean, that's the reality of it. And it's kind of hard to do both things, because I mean, Sue, quite honestly, it's like when you wake up Black in this country, you're literally in a spot of, what am I fighting for today? And I'm going to pick one. And if I'm healthy enough to go outside, then that's just what it is.
I want to circle back for a second and let folks at home know, and if people have questions or comments and want to join in the conversation, they can just put them in the comments section on the platform that you're watching, and we'll bring them to the doctor and to Monica. And Monica, you mentioned that you've been serving meals, and folks may not know that you have been working during COVID and making sure that folks who are unable to access healthy food and meals, unable to get out of their houses, you've been delivering meals since the get-go.
Yeah, so we started maybe a week before they closed Boston Public Schools. And we had about between 15 to 25 volunteer delivery drivers that range from school teachers to labor workers to regular citizens. And every day we did between 1,500 to 1,750 meals per day. And we did it for 12 weeks. We just wrapped up last week. Now we're doing care packages and produce boxes. But this is what we had to do because for a lot of people, they don't realize that there are over 5,000 BPS kids or more that already experience homelessness and being hungry. And so COVID just exacerbated pre-existing issues. It didn't really cause any. It just made the pre-existing issues worse.
And you've been working on public health issues, including violence in our communities, for a long time. And I'm wondering, was there anything about this demonstration, this protest, this time that feels different to you, Monica?
Only in the sense of so when I organized the march in 2017, we went from Roxbury to the Boston Commons with 45,000. This time it was in the community, it was community-led, community-driven, and I hired community members as security to ensure that Black and brown businesses wouldn't be destroyed. Not to negate what happened downtown, but I just feel like there were so many Black and brown businesses that didn't receive adequate funding from the pandemic. The last thing they needed was to have their windows busted out and have their businesses destroyed on top of suffering such a huge financial loss. And so I made sure I got that message across when I spoke to the crowd. I said, listen, understand where you're standing. If you say that Black Lives Matter, all these businesses are owned by Black and brown folks who are already struggling. You will not destroy our businesses. And just if I could be candid, I told them we were going to run through them like Marshawn Lynch.
Dr. Clark, I want to talk to you about your role as the Director of Health Equity Research and Intervention at Brigham and Women's Center for Community Health and Health Equity. Can you talk to me about what it is you do?
Absolutely. So I first of all, want to thank you so much for having me here. And it's just been a real pleasure to hear the work that Monica has been engaged in. I was one of those physicians who walked with you to the Boston Commons. Many of us really see ourselves as members of the community, and we walk with our communities. So the Center for Community Health and Health Equity within the Brigham and Women's Hospital is our Office of Community Benefit. And so we are the office that really helps to think through what is it that we need to do collaboratively in community to make sure that we address the entire gamut of what you need to be healthy. We recognize that health is more than just health care, that we also need to make sure that youth have experiences that prepare them for their next steps in their careers, that we think about violence and violence exposures and make sure that people who are exposed to violence within their partnerships or violence within their relationships and in communities have that support. And we also are really interested in understanding what to do, so what the interventions are, both from a perspective of trying to understand how, when you are exposed to stress, when you're exposed to violence, what that means, but also how you approach it. And so that's part of the work that I'm engaged in, is trying to connect the science to understand, how this influences health, and then to think through next steps.
I've been fascinated watching the conversations about the public health crisis and how many people are sort of finally understanding that the situation of being a Black American and African American is in itself in some ways a public health crisis. And while we were pushing, rightly so, to get the opioid crisis declared a national emergency and a crisis, it seems that this terrible convergence of the COVID-19 and another death of a Black man at the hands of a police officer seems to have put in, it just stark reality what the challenges of being Black in America are, as Monica was talking about. And I'm wondering, Doctor, what, some people are concerned going out protesting about being exposed to COVID, but are also in their day-to-day lives also facing severe challenges that could result in their health being a negative impact and also perhaps their lives, right?
That's absolutely right. And I think framing is also important in the way that we think about things. The way that I would look at it is that it isn't being Black or African American that's the risk. Racism against African Americans is the risk. That is what we are looking at. So when you are in your bed sleeping, when you are in a park, watching birds, when you are walking down the street, you ought to be able to engage in those normal activities. So it's something extraordinary, that African Americans experience in this country, that those really ordinary activities cause us to be at risk, and we need to call it out as such. So as we think about what it looks like to be at risk for coronavirus, and to be at risk when we are demonstrating our desire to have a just society, we have to keep that context in mind.
Monica, I'm wondering what your conversations are like with folks who are attending the demonstrations and protesting and may be at a particularly higher risk for COVID exposure than sort of the general population, if you will. I know we don't know that much about COVID-19, but we do have some guidelines. You know, I've had a number of conversations with people in my family urging them not to go out and protest because of the risk. But at the same time, it seems like this is the window for opportunity, and this is the tipping point between, you know, COVID-19 having such a big impact, negative impact in the community. I mean, what are people telling you out protesting about their level of willingness to take a risk?
So from the messages that I received, which are over 2,000 or more in my email and Facebook, it's, I'm really afraid of the pandemic, but I'm more afraid for my son to lose his life and him not be able to travel and do the things that a normal young person should be able to do. For any Black person in this country right now, it's truly the lesser of two evils. It's, okay, I can stay home, but if I stay home, what can I do? And if I don't stay home and I decide to go out here and protest, it feels almost like you have no choice. I said to some of the people in my community, I'm like, everybody can't stay in the house, right? I'm pretty sure that when Martin Luther King and Malcolm X and all of our amazing leaders, there were pandemics happening, there were things happening in their community, and somebody had to take the position of leadership. And for me, as somebody who was already outside doing essential work, feeding the community, it's like, okay, so I got about 30 phone calls. Monica, what are we going to do? George Floyd just got killed by a police officer. What are we going to do? And quite honestly, I hadn't planned to protest, but we had to create a space for people to grieve. We had to create a space for people to know that their anger was just. And then we had to give them real opportunities of what's next, right? Some people protest and then they go home and they eat their cheese sandwich and they feel like they've done their good deed. For a lot of our people, it's reiterating the message of getting laws passed, legislation passed, and pushing for funding for our communities. But I have a nonprofit called Violence in Boston. Prior to this pandemic, and even up until a few weeks ago, no funding towards the violence prevention efforts. All the money I've received has been to feed the community. I now have to begin to fundraise to cover the cost to do what I do on a regular basis, which is social impact work. And I think people don't realize the sacrifices that are made. I'm literally leaving my children who have been in the house for weeks and leaving my 1-year-old with his older siblings to go out and feed the community and protest and advocate for Black lives.
Dr. Clark, as I mentioned, I feel like the tipping point here is how the impact of COVID-19 on communities of color and Black Americans in particular. I don't think we can overstate enough how terrible that has been. But just for folks watching who may not be up on the info, can you talk about the negative impact of COVID-19 on the Black community?
Absolutely. So I think there's a part of it that is just the stark reality, right? So we became aware, I think, as a public health and as a medical community, that African Americans in particular were dying disproportionately through news media and through a lot of advocacy. We heard reports coming out of Chicago, and we started to get a sense of this. It continues to be difficult to get the numbers around what this looks like. So there are a couple of public sites that allow us to look at this in more detail. And the official statistics show that although African Americans make up about 12, almost 13% of the United States, we're 23% of those who have died from coronavirus. And so it's hit us really hard in terms of just the basic mortality. But there's another piece of this. Our response as a healthcare and public health infrastructure and community, I think, has also affected African Americans, and it erodes trust. When we started our work, I should also mention that I am the chair of the health equity response to coronavirus at our hospital, Brigham Health, and together with a team of clinicians, of staff, responded to COVID in our local communities in Boston. And it was just really important that we saw this holistically, and that we actually took testing out into community settings, that we looked inside our own hospital and tried to make sure that we had the equipment that we needed to speak to our patients in the appropriate languages. So there is so much that needs to be done in terms of building that trust and putting actions in place to make sure that this doesn't happen again.
Just before COVID-19 struck, we were, many of us, looking at data that shows, the morbidity rate, of Black mothers versus white mothers in the United States of America, and how high that number was. We were learning about, during the opioid crisis, that some African Americans and Blacks and folks of color weren't getting the necessary pain medicine because they were being viewed as suspect by the doctors. So it was sort of the opposite problem, that some people were getting lots of painkillers and some weren't getting the painkillers they needed because of the perceptions of what their pain tolerance was. And it leads me to wonder, how many, what's the representation and the racial breakdown of healthcare providers in this country?
Yeah, we should talk about that. I think we actually have some data, some statistics that we can show on that. I don't know if we have it available, but so the American Association of Medical Colleges actually tracks this. So they do it through surveys, and this just gives you a sense of what it looks like. So we mentioned, for example, that African Americans are about 13% of the American population, but we're only about 5% of physicians. And you sort of see, what the breakdown looks like for other groups. And so we're not very well represented, among physicians or other kinds of clinicians in the United States. And, that really matters. It has an impact on even the way that we sort of think through what health means. Having diversity, having inclusion, and making sure that our healthcare workforce represents our populations. It means that people will have people who they can relate to. It also means that the clinicians and the scientists and the physicians will be able to bring their own lived experience and their expertise to ask different questions that are important to making sure that we have a holistic approach to health.
It also goes without saying, but I'll say it anyway. It's hard to
Phone
know
disconnected.
You can achieve and get to be something unless you see people like you actually in those positions. So if all you're ever interacting with are white doctors and you're not white, you may, or male doctors, you may not know that you can do that for a living.
I think that's exactly right. So representation, incredibly important, right? To be able to see that visually. And I think that that's important for, all folks to be able to see that. I also think that, there's a framing, I think that's important. We also need to make sure that we do the kind of investment in education, sort of early education, and making sure that we have a just and a human rights perspective on the kinds of resources we need to make sure that we do break down these barriers so that more groups can have access to the kinds of experiences that would allow us to take on multiple professions and to have the kind of opportunities that would lead to the diversity and inclusion that we're talking about.
You're here with Lunch Hour Live. I'm Sue O'Connell. We're talking about all things related to the two pandemics we're facing, the coronavirus and systematic racism. And I would like to invite you to join us with your questions in the comments section. I want to know, Monica, what your thoughts are around what allies can do in this space. I think for those of us who are paying attention, especially, white folks who are paying attention, understand that there are a number of ways that we can be supportive and not take up all the air in the room as we have traditionally done, and be supportive of people who are closest to the pain to direct the way that the conversation and the action should be having. I was heartened to see the number of books about race in America that are showing up on the top 10 lists at the New York Times and at Amazon. But if you had like 3 takeaways for folks watching from home who might be white or might, for the first time be understanding the depth of this problem and want to do the right thing? What kind of advice would you have?
So first, I would say that those conversations start at home. I am a firm believer that you start with your family members, your children, your grandparents, your aunts, your uncles, in regards to race, and have that conversation in your house. Hatred and racism is learned and taught behavior. I think those conversations need to happen at home. The second thing is contribute. There are so many Black and brown businesses and nonprofits who are inequitable, haven't received funding, don't get the same support as their white counterparts. Find a nonprofit, find a Black-owned business, find a Black movement if that's your thing, and get behind someone and allow them to have the support. The last thing I would say is legislation. Right now, the Black and Latino Legislative Caucus has 10 points in regards to police brutality that they're advocating for from the state, municipal, and federal level. Locally, and then me personally, I've been helping to advocate for 3 pieces of legislation on the federal level: the Eric Gardner law, the Andrew Curse Act, and the Stephon Clark law. Real quick, Eric Gardner, preventing chokeholds, it just passed in New York. We're trying to get it passed federally. The Andrew Curse Act, it just passed in New York. We're trying to get it passed federally, which is you are required as a police officer to provide medical attention to anyone in your custody who expresses distress. And then the Stephon Clark law, which makes it criminal for an officer to shoot you 8 times in the back as you're running away. It's sad that we have to actually advocate for these things because they should just be automatic, but this is where we are in 2020. And I guess I would say, similar to what Will Smith says, it didn't just start happening. It's just that we have video footage.
Mm-hmm. Are you feeling hopeful right now? I mean, a lot of folks that I'm talking to actually feel like there's been a sea change. Obviously we need to see action and not just words, and we need to see the action after the protests and the demonstrations. But is there anything about your point of view that feels that we've crossed over a bridge?
No, I think that for the longest time, Black people were in a war that we never showed up for. And it almost was like we were suffering from PTSD and kind of just like drained and exhausted. I think right now, Dick Gregory said it best on a video. He said, it's not that Black people have been more tolerant. It's just we have to stop tolerating it. And so I think Black people in this country have gotten to a point where enough is enough. If that means that we have to, it wasn't until Black folks started protesting that an officer was arrested. 5 days had passed and no one was arrested in the homicide of George Floyd. And I think Black people are like, so you're not going to keep doing this to us and think that we're not going to say nothing. And so we've seen it too many times. It wasn't that long ago that Eric Gardner was saying he couldn't breathe. It wasn't that long ago that Andrew Curse was in the back of a police car in Schenectady, and 70 times he said, I can't breathe and I need help. And by the time he got to the police station, he was dead. I think that Black people are like, okay, you know what? I need to show you guys physically that we are here. You're not going to keep killing us, and there will be repercussions. And I think that's just where we are in this country. My grandmother once told me civil rights is one in every generation, and I think this is our civil rights movement.
Dr. Clark, I want to talk to you a little bit more about the institutional racism that exists in our healthcare systems, and it's from top to bottom. And wondering if there are any recommendations you have for how people should think about it, ways that they can change it. Is there work that should be being done in the insurance companies, in the insurance world, in the medical schools? I mean, what are some things that we need to keep in mind in order to dismantle institutional racism in healthcare?
I think it's important to note that healthcare is not disconnected from what is happening in society. So as we think about the ways, how we want to put action forward, we need to get out and vote. We need to be civically active, and we need to make sure that we have the representation in place to create the infrastructure for making sure that everyone has access to care, making sure that the basic human rights around education, these basic foundations that we know are related to health, are supported. There's a New York Times columnist named Charles Blow, and I thought he put it extremely well. We often talk about, the Civil Rights Act of 1964. It's time for the Civil Rights Act of 2020. We really do need to try to get really specific. We need to put action steps in place, and we need to have an agenda that finally recognizes the humanity of African Americans so that individuals don't have to continue paying this price. It's important that we demonstrate. It's important that we go out and that we make our voices heard. But we can't have individuals pay this price to make us act. We have to be proactive, and we do have to make sure that when we think about health, when we think about what it means to be human, that we put those structures in place to protect us and to advance what this means. As a physician, it's we often think about the numbers and statistics, but when you're sitting in front of your patient, you want to make sure you're sending them back out into a world that is respectful of them and that helps them to have their best health. So it's an important thing to situate our conversation in that context.
All right, I want to thank both of you. Good to see you, Monica, Dr. Clark. It's great to meet you. And I want to thank you both for the important work that you are doing. And stay safe. Good to see you. I hope to speak with you both soon. Thanks so much for joining me today on Lunch Hour Live. I want to thank everyone for watching at home or in your car or wherever you are. Make sure you follow us. We're going to continue to bring important stories and news and voices from all across our great Commonwealth